So let us go to syndrome, pattern, and disease. The topic is TCM and biomedicine. The word syndrome comes from the Greek roots syn, meaning together, and dramin, meaning to run. That is, to run together or to go together. Therefore, the word is defined as a set of signs and symptoms that tend to occur together and which reflect the presence of a particular disease. A syndrome is the association of several recognizable clinical features, signs and symptoms, or other phenomena that often occur together. The presence of one or more of these features alert the physician to look for occurrences of the rest in order to confirm or rule out the syndrome in question. The description of a syndrome includes a number of essential characteristics that, when concurrent, confirm the diagnosis of a condition. Frequently, said characteristics are divided into A, typical major symptoms and signs that must be present to confirm the diagnosis, and B, minor findings, some or all of which may be absent. Some technical descriptions will specify the minimum number of major and minor findings required to confirm the diagnosis. TCM pattern. A pattern of disharmony in TCM is not a fixed entity, rather than a collection of signs and symptoms that are specifically linked to a condition or disease. The pattern represents a series of functional relationships that become apparent after a process of analysis and interpretation of all findings in a given situation. The TCM pattern is thus a snapshot of a general state of well-being of an individual at a given time. It can be thought of as a dynamic schematic of the individual's constitutional tendencies, physiological processes, and current influences to their state of health, including lifestyle, emotional disposition, diet, and the prevailing weather patterns of their locale, etc. The corollary of this is that a pattern of disharmony may not present as clearly recognizable disease. Rather, it portrays the tendencies that may lead to a pathological manifestation, thus allowing the practitioner to construct a holistic preventative treatment before a disease process is established. Pattern discrimination. For pattern discrimination is the process of analyzing the data obtained through the four methods to arrive at a diagnosis concerning the patient's pattern of disharmony, according to TCM theory. Patterns are discerned from the presence and or absence of given signs and symptoms in combination. This is important because almost any sign or symptom in Chinese medicine can point to more than one pattern of disharmony, depending on what other signs and symptoms occur with it. The sum total of what is and is not present paints a picture of the current stage of the disease process, revealing its etiology, location, and nature. The pathophysiology of the condition is deducted from the reactions, like signs and symptoms, manifested by the patient, which may vary as the condition progresses. This model constitutes the foundation for establishing a therapeutic strategy that addresses the specific current condition of the patient, while also considering their basic constitution, inheritance, environment, and current life circumstance. In sum, the TCM pattern of disharmony reflects the essential nature of the disease process at the moment when it is observed. A TCM pattern of disharmony reflects the essence of the disease at a given point in time. Disease versus pattern. Disease is often defined as a condition opposite to health, that is, the absence or lack of health. More specifically, the term broadly refers to any condition that impairs normal function. Disease is a name given to an abnormal medical condition that affects the body and is associated with specific symptoms and signs. In many cases, the term disease is used interchangeably with disorder and illness. The term disorder in medicine refers to a functional abnormality or disturbance and is often considered a more value-neutral and less stigmatizing term than disease and syndrome. In biomedical terms, disease frequently refers to a certain condition where the nature and regularity are recognized from its causes. Conversely, a TCM pattern focuses on the organism's reactions, not its cause or etiology, although these can usually be deduced from the overall picture of the patient's disharmony. Thank you for your attention.